Well, good morning, everyone. It is such a huge pleasure to have so many of you join us here at Biolite for the Beauty Triangle's first ever event in Dubai. I'm really excited to be here with all of you today. I'm Francesca Oakeyman-White, and I'm the founder of the Beauty Triangle. Now, for anyone who's new to our event, a little bit of background. We launched the Beauty Triangle in 2019 back in London with the sole mission to educate and empower consumer audiences on all aspects of their health and well-being, and always critically from a holistic standpoint. When it comes to wellness, I've always felt very passionately that it's not about a one size that fits everybody. It is very much about taking that personal bespoke approach, and I really believe that the most powerful results come from a combination synergistic approach. On the flip side, I'm also a beauty editor, and I write day in, day out about these weird and wonderful treatments that we're going to be discussing today. So I also know personally that what we're going to be talking about can sometimes feel overwhelming for consumers. So our aim is very much to create a safe space where we can have the conversations that no one is really having, but also to host them in collaboration with some of the most trusted voices in the wellbeing space, so that as consumers, you can ultimately make the safest, best informed decisions that are really right for you. We're going to be here with the most amazing lineup of panelists. As I said, it's important that we always put expert information from true experts out there. I'm delighted to be joined today by dental surgeon and aesthetic practitioner, Dr. Yusra Al-Mukhtar, who recently was awarded Best Aesthetic Practitioner back in the UK. So really excited to have her with us. Straight from Harley Street, literally, he landed about 3 hours ago, and look how fresh he looks. We need all your tips. Consultant dermatologist, Dr. Derrick Phillips. And finally, we wouldn't be in this beautiful, dazzling space if it weren't for Mona Mirza, who is the CEO and founder of Biolite. Mona left the UK, I think, in 2007, and you came over to the UAE set on creating the region's first ever healthness retreat. And I think what you've created here is such a testament to evidence-based, cutting-edge medicine and well-being. So thank you very much for hosting us, Mona. And we're here this morning really to talk about how to power up, whether that's about how to restore a glowing complexion, wipe away signs of tiredness from the face, or whether it's about how to boost our metabolism and really biohack our way to a more resilient body. All conversations that I think are very topical right now. Hopefully you should have all found a program. I can see a few of you holding them. You'll find information on all of our speakers. They're all important Instagram handles. And there's also a referral card on the back. So following the conversation, if you'd like us to connect you with anyone that you hear speak on the panel, you can just leave your email address, tick the box, and we'll connect you. Dr. Yusra and Dr. Derrick will be whizzing back and forth to Dubai in the future. Well, Derrick, you're already here now doing some consultations and treatments, so the UK's loss temporarily is your gain over here, I can assure you. We'll have time for audience questions at the end, so anything you'd like to ask, do sort of save it up and we'll come to that. And there's an amazing goodie bag for everyone here. We've got some wonderful discounts. I think it's 20% off Softwave, Mona, you said, for the next week for everyone in attendance. We've also got amazing skincare, Biolite's peel pads, some beautiful travel-sized serums, an emerald gua sha. I think that's everything. And there's also an amazing raffle taking place, isn't there, with Softwave at the end. So more details at the end, but you can put your name in and maybe have a fresher, tighter face at the end of all of this as well. Anyway, that's enough talking from me. I'm going to pass over to our speakers. They're going to say a very quick hello, introduce themselves, and then we'll get started with the main conversation. So, Dr. Yusra, thank you.
Hi, I'm Dr. Yusra Al-Mukhtar. I have 2 clinics in London, one in London, one in Liverpool. I'm a dental surgeon by background and have a background in head and neck surgery. And I'm delighted to be here today with the Beauty Triangle and with Mona. I have a huge kind of ethos about radiance on the outside, wellness on the inside. So this is what we're going to be talking about today, and it's exciting to be here.
Hi and good morning. I'm Dr. Derrick Phillips. I'm a consultant dermatologist based in Harley Street, but I also am resident here, so I come back and forth every 6 to 8 weeks. So my expertise is pertaining to everything to do with skin, hair and nails, so helping you really to address any skin concerns, any hair and nail concerns, and helping you to feel your best self. I'm delighted to be here, part of the Beauty Triangle, and of course always happy to be back at at Biolite, which is my home in Dubai, and I look forward to the interesting, engaging conversations we're going to be having this morning.
Oh, thank you, Derrick.
Oh, you've got one. Yeah.
Oh, you got one. Where did you get one? Oh, lucky you.
Hello, everyone. I'm Mirza. I'm the CEO of Biolite Aesthetic Clinic. I'm also a medical esthetician as well as a trained certified hypnotherapist. And I'd like to first of all thank everyone, particularly Fran, for choosing Biolite as the first place for launching the Beauty Triangle. I'd like to thank Yusra and Derrick for making their way out, and I'd like to thank all of you for making the effort to coming out this morning to hear us. Thank you.
Thank you, Mona. So we'll start the conversation with Dr. Yusra. She's already introduced herself, but I've known Yusra for a number of years now, and I always find her a very empowering woman to spend time with.
Oh, thanks.
But she also has a very deep-rooted interest in human psychology, which I think is fascinating because she really uses modern aesthetics to enhance that in her patients. So Yusra, maybe you can start by telling us what feeling energized and being energized means to you.
I think feeling energized to me is feeling full of vitality and vigor and being full of enthusiasm with a positive mindset to take on all of life's opportunities and to tackle all of the challenges that we'll all have on a day-to-day basis. And to me, I think feeling energized is a symptom of health and wellness. Health being not just the absence of disease, but the state of complete physical, mental, and social well-being. So I think, again, being energized and feeling well is to feel like you're thriving, not just surviving.
And for you, so Yusra has a family of 3. She has 2 clinics. I think if anyone understands the importance of thriving, not just surviving, you definitely have some tips for us. But tell us a little bit about the sort of lacking in energy and the tiredness that so many of us, I think, seem to complain about. What is exactly happening at an anatomical level that's causing this to happen to us?
On our faces?
Yeah.
Well, first of all, I think how we look on the outside is a manifestation of how we feel on the inside. There's this mind-body connection, and we cannot say that actually when people are coming in to have aesthetic treatments, it's for vanity alone. Often they're coming for treatments because they want to feel good. And they often will come and say, well, I want to look less tired, I want to look less angry, I want to look less sad. There is an emotional attribute. And we often wear our emotions on our face, and they say that nonverbal communication, 80% of our communication with others is nonverbal, and that comes from our micro-expression. So it's
fascinating.
How we're looking at each other, how we're speaking to each other. Am I raising my eyebrows and looking surprised? Am I frowning and looking angry? Am I telling you I'm not approachable? Or am I smiling and being welcoming, warm and friendly? So tiredness itself comes from not just our posture and how we hold ourselves, but from a facial anatomical perspective, will occur through the natural physiological process of aging, right? And when we are aging, it's important to understand that our face is not just skin on the outside, we're the skin guru, but we are whole human beings, right? And none of our organs are just kind of floating around there. Everything talks to each other. And in our face is multi-layered. We have skin on the outside, then we have superficial fat underneath that, then we have a layer of muscle, then we have more fat, and we have bone. So all 5 layers of the face are changing as we age. On the outside, our skin, as we are aging, is starting to lose collagen. Collagen is a very important protein that gives our skin structure and integrity. Then we're losing elastin, which gives us bounce and elasticity. And then we're losing hyaluronic acid, which gives us radiance and hydration. So when you lose that through the process of aging or stress, and there's a whole concept I've called stress face, and we can talk about that. And that can accelerate the appearance of aging. And childbirth, by the way, I've been there 3 times. I'm telling you, that makes you look tired. And feel tired. And feel tired, absolutely. So when you're losing all of these important structural components of the skin, your skin looks more sallow, less radiant, less hydrated, looks a little bit more tired. Then underneath that, the superficial fat is changing. So in some patients, they're getting excess fat around the nasolabial fold, so they're starting to look a little bit heavier. Same around the jowls and the double chin, they're starting to look heavier, and that can give the appearance of sadness and tiredness. Around the eyes, what's happening is that the muscles that hold the ligaments of the face up start to become loose. And I often tell my patients, think about this like the rubber band or the elastic around your underwear. Sorry to be crude, but over time, that becomes loose and you shuck it away and you get your new underwear. You can't do that with your face. So it's important to understand that the muscles of the face will change, and these muscles are what control function. They control micro-expressions, and they hold your face up. So as they get loose, and they get looser in women more than they get loose in men, you start to get a drop of the eyebrow, and again, you're not holding your eyelid up as much as you once were. So
unless you're like me on Zoom and physically holding your face up.
Yeah, and some people actually do that. We call it compensatory ptosis. They become aware that their eyes are starting to sag, so they're doing this all the time to compensate.
And straining this area as a result.
And getting headaches.
Yeah.
And then the socket around the eye, the actual bone gets larger. So as that gets larger, your eye sits deeper in, so you get more prominent hollows. And then if you're not sleeping as well, you know, you're dehydrated.
It's this constant sort of cycle, isn't it?
Totally. So now you've got puffy eyes, you've got deep set eyes, you've got darkness under the eyes, and you've got sagginess around the eye area, and that gives the illusion of tiredness. And if you wake up and you look in the mirror and you look like you're tired, guess what? You're going to act like you're tired.
I think psychologically that link between how we feel on the inside and how we're looking outside obviously is very, very powerful. And that's what I love about your approach, because I think it really marries those two things. But I also think it's fascinating how you've described all of those different layers anatomically, because I think we need to understand what is causing these things. As soon as we understand it, that knowledge is quite powerful.
Absolutely.
And then we can actually make the changes. So I'm hoping with that really quite depressing analogy of what will happen to all of us, that there might be also some solutions. I mean, what can we do and what do you do? Because you're a real expert when it comes to injectables to start with, amongst many other things that we're going to be discussing. But what would be the first steps that you would take to try and restore that structure, put everything back into the right place and restore the energy to the face?
So firstly, I want to find out what's bothering my patient, right? So is it, and I have a scale and I say to them, emotionally, why are you here today and what is it you want to achieve? Is it I want to look less tired? Is it I want to look less angry, less sad?
Can I just say, I love that you start with emotionally, what are you looking to achieve? I think that's a really important point versus physically, what do you not like about your face?
Exactly. And I think also, you know, with aesthetics, I think I can teach a monkey to inject, right? So anybody can inject, but it comes down to artistry, and it's important to understand how things sit together. And I also strongly believe that not everybody needs high cheekbones and tapered chin and large lips. I would look ridiculous with Angelina Jolie lips. Like, she looks amazing, but that's because of proportion and balance. So I'm not ever trying to create or take a cookie cutter approach and create clones of each other.
Agreed.
So it's a very bespoke journey for the patient, and it comes down to, and always starts with, what's your why? What's your end goal? What do you want to achieve? What emotional attribute do you not like, and what do you want to see in the mirror when you're looking in the mirror? And then we identify the kind of the number one thing that they want to achieve. It might not be that. It might not be an emotional attribute. It might be, I hate my nose. And that's another thing. I do a lot of rhinoplasty work. And I have a lot of patients.
Non-surgical rhinoplasty.
Non-surgical rhinoplasty. And often patients come and they say, not just I don't like my nose, I hate my nose. I won't sit next to someone side by side because I don't want them to see my nose. I'll always sit opposite them. If I'm driving, I'll always stop before the red light so that the person in the car next to me doesn't see. I'll never wear my hair up. I'll always wear it down. So these are the little psychosocial changes that, and the conscious decision making that they make because they feel held back by their appearance.
Exactly.
So your question was?
What are the solutions?
The solutions. So number of solutions. And I think a really important thing is to understand that volume replacement is important where you have lost volume. So if you've got sunken cheeks or hollow under eyes, or indeed you've got a bump on the nose and you want to correct the structure, then you need volume. And volume often comes non-surgically by the way of dermal filler. Dermal filler is fantastic, but it's just one tool in our toolkit. And it's often just addressing the deeper volume loss, right? So if I'm trying to lift the face, if there's actually sagging tissues, if there's loss of radiance, if there's loss of elasticity, dermal filler alone isn't going to cut it. And so from an injectable point of view, dermal fillers is fantastic. You can make phenomenal artistic changes by the way of volume, volume restoration or sculpting the face and replacing that lost volume.
And often with even the most judicious amounts as well. Like you say, the nose can be the tiniest amount, and it takes the nose from being something that's quite prominent to something that's completely invisible in your face.
I call it an empowering transformation because it's not just the artistic change, it is the empowerment that the patient gets after.
Yeah.
It's them coming back and saying to me, I say, so how have you been over the last year? And they say, I don't think about it anymore. I wear my hair up. That's what I want. I want them to feel empowered to go out and live their life fully. So fillers is one. Toxin, people call it Botox. Botox is the brand name for botulinum toxin type A. It's an injectable. We call it a neuromodulator. It stops the nerves from sending a signal to the muscle to contract. And it's used traditionally in the upper face to lift sagging brows, to stop that angry look, to soften lines and wrinkles around the eyes, but we also use it in the lower face to lift a sagging downward smile so you can get an upward kind of more positive welcoming smile, takes away the appearance of sadness. We use it to lift the jawline.
I was about to say, I have it in my neck as well to sort of sharpen that jawline as well, because then it stops everything pulling down, doesn't it?
Exactly. And then, when I talk about stress face people who are looking, quite angry, and they get these number 11 lines. Who are grinding, and they get enlargement of their masseter muscle, so they can start to look more masculine in the lower jaw. And sometimes we use botulinum toxin to slim the face. So those are kind of our traditional injectables. But aesthetic medicine is moving very, very quickly towards regeneration.
Yeah, agreed.
And it is not about, as we said before, it's not about vanity alone. It is about, I would say, wellness and empowerment. So when we're talking about fillers and toxin, you know what we're doing? We are masking aging. We're making you look less young, but actually, you're still old on the inside. So what we're trying to do with our biostimulators now, injectables like polynucleotides, like Sculptra, like Radiesse.
Things that are stimulating the collagen and like the actual building blocks of the skin.
This is amazing. And I use this a lot in clinic. When you use these injectables, what we now know, and actually Sculptra has been around for 25 years, is that we can recreate collagen, we can recreate elastin, and we can recreate hyaluronic acid, which means you're gonna need less fillers, you're gonna need less toxin. And they last a really long time. But it's not, again, it's not just aesthetics. If you have more collagen, collagen is not just there to make you look good. It actually serves a function. It's there for wound healing, wound differentiation, cell differentiation. It's very important as a molecule for health.
Agreed.
And as you're aging, and age is now more and more being seen not as a disease, but a precursor for the onset of age-related disease. In the skin, this is also true. As you age, you're more likely to get skin cancer. You're more likely to get pigmentation. If we can switch off the aging cells and switch on the anti-inflammatory, healthy cells, then you're not just going to look good, you're not just going to age in reverse, you're going to age much slower and look better for longer.
And feel good about it at the same time. I'm really pleased that you mentioned the regenerative sort of capacities of what we're looking at now, because when we're looking at the body, there are some fascinating devices now that are coming to the forefront, one of them being the Emerald Laser, which I know you're an absolute expert in. I wondered if you could tell us what makes the Emerald Laser a little different to the body contouring devices that we might know and love already.
I think to understand that, it's important to understand fat. I think a lot of people view fat as this really annoying,
as the enemy.
As the enemy. It's this really annoying thing in our body that makes us look pudgy, and we're always trying to take away fat, right? Actually, fat is important. Our body is created by grand design. Every single cell serves a function, even fat. And fat is there for homeostasis. It's there for lipids. It's got lipids in there that are very important for the absorption of vitamins. It's there for temperature regulation. It also helps with mood regulation. So it's multifaceted. Now, as we are aging, our hormones start to change. So women start to lose estrogen, progesterone, and testosterone. Testosterone is a female hormone too, and men start to lose testosterone. With estrogen, it has this very important anti-inflammatory property. It helps us to preserve our bone structure, and it also helps with fat distribution. So pre-menopause, before the menopause, the fat distribution in a woman, the amount of fat in the abdomen of a woman is about 5%. Post-menopause, her total body weight, the 20% of it comes from fat around the abdomen. So you get this fat redistribution.
And this is what they refer to as the hormonal belt, don't they?
Yes.
And it's so hard to tackle.
Very hard to tackle because the hormones are off balance, right? So then we talk about holistic care and hormonal balancing. But the other thing is fat, it's like you can have a healthy skin cell, you can have a healthy fat cell or an unhealthy fat cell. Here's how fat works. When you hit 21, you have the number of fat cells you have for life. So let's say God gave you 100 fat cells in your abdomen. I think God gave me more than that, but let's say there's 100. So traditional liposuction or cool sculpting, and I have cool sculpting in my clinic, removes fat, and it removes fat permanently. When you take away large volumes of fat, this causes an imbalance in the body's grand design. So you start to put on weight in other areas. Also, a lot of people who have a lot of fat removed start to have symptoms like anxiety, depression, not being able to sleep well, mood dysregulation. This is something I hear a lot in my clinic after patients have had liposuction. So research has been quite quickly moving towards trying to preserve but optimize the function of that fat cell. Because if you have an unhealthy fat cell, and when you're sitting at home eating burgers, chips, and pizzas, your 100 fat cells expand. When you're healthy, your fat cells shrink and they become healthy fat cells. And your cells talk to each other. Every single cell in your body talks to each other. Your organs talk to each other. So if you have an unhealthy fat cell, think a bit of it like rotten apple spread. That unhealthy fat cell tells the next fat cell to be unhealthy and the next fat cell, and it leaks out pro-inflammatory messages. And inflammation is the precursor to all disease, okay? So when we are looking at optimizing the fat cell, what we want to do is make a lean fat cell, and we want to optimize its function and leak out anti-inflammatory messages. So Emerald works very differently in that it doesn't kill the fat cell, it actually preserves it, but it helps it to become healthier by doing two things. Number one, it emulsifies fat, and so the fat, and it creates a little pore in the fat cell. It's really fascinating if you look at it under a microscope. And the fatty acids and the triglycerides leave the fat cell, and then you need lymphatic drainage, and it's important you walk and drink lots of water to get rid of those fat cells.
So actually it doesn't remove the fat cell, like you were saying, all the other things, it just makes them tighter and leaner and more contained, and that conversely reduces circumference and the appearance of excess fat.
It basically mimics weight loss, because when you put on, when you're losing weight, your fat cell is preserved, but it just becomes smaller. So it's mimicking that, and it's getting rid of those triglycerides, the extra fatty acids. It starts to make it function healthily. Now here's another thing that happens when we're aging. Inflammation goes up, but also mitochondria starts to become inefficient. Mitochondria is like the engine to your cell, okay? So think of your cell like a car, and the engine is mitochondria, and the fuel is ATP and NAD+. When you're getting older and older, your mitochondria start to function less efficiently. So your cells start to chug along. It's not working as efficiently. So all of our work when we're doing biohacking is about how can we get that mitochondria to be optimized. If we can do that, we can actually slow down the onset of aging, which means slow down the onset of age-related disease like Alzheimer's, like dementia, like cardiovascular disease. You know, and again, everything is connected. You can't treat the body without understanding the mind, nor the mind without understanding the body.
Well, and look how interlinked they all are as well. That's exactly what you're saying.
So when you're in a pro-inflammatory state, another thing is that your body, all of the fuel, your energy is busy trying to clear up that inflammation. That results in the guts becoming dysregulated, so your gut microbiome becoming dysregulated. And remember, from your mouth to your outside is one long channel, and if your mouth is got more bad bacteria than good bacteria, you're 6 times more likely to develop Alzheimer's disease. This is scientific fact. So the whole concept of optimizing health is absolutely vital. And so you're asking me about, you know, age-related, how do we make ourselves look less tired? It's about how do we actually optimize health and wellness. And sometimes we use fillers to make you look good. Sometimes we use device-led treatments to energize the mitochondria and to optimize the fat cell. Sometimes we use muscle tightening treatments to lift the face. It really is a multimodal combination treatment.
And I think we're in such an interesting era now where the boundaries are really becoming blurred between what is aesthetic and what is about regeneration and wellness. And actually, the benefits that you're getting from devices, I think, particularly like the Emerald, show that it can all be part of one modality. How many sessions, so you've been using this in your clinic for a while now, how many sessions do you recommend for somebody who is looking to sort of boost their metabolism, have a little bit of healthy weight loss and really sort of rediscover that sort of lost energy?
So it really depends on what I'm dealing with. Emerald itself has 22 FDA approvals. FDA is a regulatory body that ensures that a device does what it says on the tin, and it's not just been shipped over in the back of a van from China. So we know that this device works, and it works well, but it has different kind of treatment options. Sometimes we treat cellulite, and it's got FDA approval for cellulite. And for those patients, I would say 6 sessions. If I'm treating a patient with a high BMI of 40, so they have obesity, then I would say 10 sessions, usually 1 week apart. And if I'm doing pain control, because now we can treat patients who have chronic pain, or they just want, they're trying to optimize their health, then I would say 6 sessions.
Because you're looking at the reduction in inflammation there.
Exactly. And so it really does depend.
And when it comes to results, I know this is a hard question to answer sometimes, but how long can people expect to see results for? I'm sure it's all very much benefited by exercising and eating well and the whole sort of holistic package.
That's a really hard question to answer, because it's like going to the dentist and getting your teeth cleaned and saying, how long are my teeth going to stay clean? Exactly. It depends on what you're doing at home, right? Yeah. So it's really important that patients understand that when they're tapping into these treatments, home care is essential. It's really important that you understand that these treatments are not an alternative to a healthy lifestyle. It's an adjunct, or sometimes a kickstart to a healthy lifestyle.
Absolutely.
So as long as patients are maintaining healthy lifestyle habits, I would expect the treatment results to be long-term.
Amazing. Well, thank you, Yusra. That was such an amazing overview of everything from face to body and energy and mitochondria involved as well. So really good overview. Thank you very much.
My pleasure.
I always learn a huge amount for being sat next to Yusra, so that was no different to normal. Thank you.
My pleasure.
Our next amazing speaker is Dr. Derrick Phillips. He is a consultant dermatologist, absolute authority on everything to do with acne, eczema, pigmentation. And I've always personally found Derrick to have a very calming presence, which I think is highly important when your skin is in the throes of having a meltdown, or you are, more to the point. But Derrick, I'm fascinated because you're a predominantly London-based dermatologist, but you're now over in the Middle East, regularly treating the skin. What are the concerns that patients at Biolite, for example, have when it comes to their skin out here?
So I see people for a range of skin concerns, but in terms of the common theme, so the most popular concern that people come to see me about is pigmentation. And at the core of it, it's because Middle Eastern skin is very rich in melanin, and that is responsible for the diversity of skin tones that we observe. But pigmented skin is also very sensitive, so it will produce additional pigmentation in response to the slightest stimulus. So it could be UV radiation, blue light from the sun. It can also be inflammation of myriad causes, and also hormonal changes. So it's really, I see pigmentation is usually the most common thing I see.
And that's so interesting, sorry to interrupt, only because I was under the impression that everyone, because we're in a hot country here, everyone has a lot of sun exposure, but actually what I keep finding out is people stay inside, their vitamin D levels are actually very, very low, but actually at the same time you're talking about things like UV light, you're talking about blue light, you're talking about hormonal changes. These are things that actually we almost need to be even more concerned about, because that is really having a deep-rooted impact on what's happening to our skin at a pigmentation level.
Yeah, I mean, I think it's always important to understand that our skin is linked to lots of different exposures that you might not think about. Even the story about blue light's a relatively new thing.
Yeah.
So we were all focused on UV, but actually we now know that sort of blue light that we get from the sun, so not the screen, so you don't need to panic, you don't need to put your phone to it just yet. But blue light that we get from the sun, we know that that can also stimulate production of melanin, or can accelerate the aging process. So it's not just about having a sunscreen that's going to protect your skin from UVA and UVB, but also making sure that in the sunscreen there's protection against high energy visible light, which is the scientific way of explaining or describing blue light. So tinted sunscreens can do that. So any sunscreen that contains iron oxide, iron oxides are very efficient at blocking visible light. But also you can have chemical sunscreens which will have specific filters, and there are a few on the market as well which are very effective.
You're a big Heliocare fan, aren't you?
I am.
Not endorsing anything, but I personally love it as well.
Yeah.
And I feel like there's a formulation for every skin type, which is always brilliant.
No, exactly. So in addition to pigmentation and pigmentary concerns, I also see people for mole checks and general sort of lesion checks. And one of the big reasons for this is that sort of there's a big sort of European diasporic community within Dubai. It's become somewhat of a metropolis.
Yeah.
And so European skin is often fairer and it's more susceptible to the harmful effects of UV radiation, and so it's about just making sure that sort of we catch anything early by doing regular mole checks and regular skin checks.
You need to be really vigilant. I think you said to me it's the wrong skin in the wrong climate or something almost, isn't it? And we just need to be extra vigilant if this isn't what we were sort of,
Exactly, yeah. No, in terms of evolutionary sense, European skin isn't really, it's not designed to be in the harsh, high UV index sort of Dubai climate, and so when you are here, it's important that obviously you want to enjoy and make the most of the climate. That's why a lot of people move for the weather. And
exactly. Yeah. I mean, apart from recently, but yeah, most people are over here thinking sun.
Yeah.
Tell me a little about the different forms of pigmentation that you're seeing, because pigmentation covers all manner of concerns, doesn't it?
Yeah. I mean, so broadly, I see three common types of hyperpigmentation. So the first type is just sunspots, which everyone's aware of. So sunspots are sort of lightly pigmented, typically brown marks on the back of the hands, can also be in the face, and they're often seen as a sign of skin aging, but they're caused by long-term exposure to UVA radiation and also blue light. And they can occur in all ages, but you tend to see them more in middle age and sort of later ages.
I just feel like it's because you've done the damage to your skin sometimes at a younger age, and then as that pigmentation comes up towards the surface. I now don't go out of the house without SPF 50 on my face, but I definitely did not behave like that when I was 14, 15, 16. So the pigmentation I think I see now really is almost what's been brewing in the background for a while.
No, exactly. It's often the case that by the time we're aware of these things, we've had the exposure.
Yeah.
But the good thing is that with pigmentation, there are very good and effective ways to treat it. And also, once you've treated it, then you can implement measures to prevent new pigment from being acquired. So, so that's sunspots. And then the other thing that I see quite often would be post-inflammatory hyperpigmentation. So post-inflammatory hyperpigmentation refers to the dark marks that develop on the skin after acne or after any rash, and it's much more common in skin of color. And as I mentioned before, skin of color is very sensitive, and so any stimulus can result in the pigment producing cells producing extra melanin. And when that happens, these marks can often last for longer than the original problem. And so when I see people, it's about recognizing that, and Yusra and I were talking about this early, when you see someone for acne, for instance, often the acne is actually the least of the problem, it's more the pigmentation.
You need to get ahead of the pigmentation and scarring, because otherwise you go from covering up breakouts to covering up pigmentation that lingers for a long, long time.
Exactly. And the acne may last for, a week if you're on, a few days to a week, but the pigmentation can last for months and possibly years as well.
You're so right. And they all say, actually, we're more concerned almost about sort of an uneven skin colouring and texture than we are even sort of fine lines and wrinkles sometimes, which can give us a bit of character. Actually, just having an even skin tone is what really denotes health and well-being and vitality. What are your sort of first line of defence treatments when it comes to then tackling pigmentation? Are we thinking peels, lasers? Is it sort of topical solutions?
Yeah, so I think it's about understanding what the type of pigmentation is. So for the two forms of pigmentation that I've described. So obviously the first thing is sunblock, so having a good sunscreen is going to prevent it from getting worse, because the sun will make any pre-existing pigmentation a lot worse. And then it's sort of assessing the type and the extent of it. So if you've just got a localized patch of hyperpigmentation in the back of your hand that you want treated, then that could easily be addressed with a laser or energy-based device. So pico lasers are particularly effective, particularly in skin of color. We worry less about them dissipating heat and causing other pigmentary issues, because of the fact that the technology means that with the pico lasers you can target very specifically a pigmented area.
So you can literally say it's that spot.
Exactly, but also that the heat profile, because the way in which lasers generally work is that they target something, they heat it up and they destroy it. But as I mentioned, with skin of color, any heat or any heat that disperses is going to cause a new pigment production. But with the pico lasers, it's their heat generation profile is like that, so it's very intense in the middle and it drops off massively, so that you get this sort of isolated and localized disturbance or destruction without.
And it sort of shatters the pigment.
Exactly.
And then what about the topical solutions? I feel like things like tranexamic acid have become very, very sought after when it comes to topically managing pigmentation.
Yeah. So I have a number of tools that I use for managing pigmentation of different causes. In terms of topical treatment, so tranexamic acid is one that is at the fore in my toolbox. Tranexamic acid, for those of you who probably thinking, I've heard this name before, what is it? Well, tranexamic acid is a medication that has an FDA license for use in management of heavy periods, but we've also found that it's very effective at stopping pigmentation, and it's become one of the most commonly used treatments for melasma in Southeast Asia, particularly Singapore.
Oh, really? That's interesting.
Yeah. So tranexamic acid can be taken orally, but it's just as effective as a cream, and it doesn't cause much irritation, and it can also enhance in-clinic treatments if you use it as a solution, for instance, for microneedling.
Yeah, exactly. It's like what Yusra was saying, there's only so long that a treatment in clinic is going to last for unless you do your work at home. So actually going back home after you've had your laser probably, and then taking your oral tranexamic acid, or using it in, a cream or a serum. Is there any benefit to sort of combining them? Would you get sort of extra bang for your buck if you were to take it in pill format and then put it onto the skin?
So there's been some studies which show that there's no harm to taking them both. The benefit is probably marginal, and the tablet form is probably better than the cream form. So what I would say is if you can take the tablet, it's better, but I tend to promote the tablet more for conditions like melasma, because it's quite good at uniformly reducing pigmentation. And then if you can't take the tablet, for a reason, because the tablet isn't suitable for everyone. For instance, if you're someone who's had blood clots in the past, or if you're someone with a family history of blood clots, or if you're taking certain forms of birth control, it may not be the best for you.
Yes, exactly.
Then the cream would be a very good option.
Yeah.
And the cream can be used with other treatments as well, because with pigmentation, it's often good to have a multi-pronged approach, so addressing it from lots of different angles. So we know that tranexamic acid works in one way, so it reduces the activity of an enzyme called tyrosinase, which is crucial in production of pigment. But you can, for instance, use vitamin C, which can tackle it another way. You can use niacinamide, which prevents the transfer of the melanin from cell to cell. So if you use a multi-pronged approach, then you sort of, it doubles or triples your chance of success.
Yeah, agreed. And I think vitamin C and niacinamide are sort of creeping into everyone's skincare regime at the moment anyway, powerful antioxidants as well, which we just all need to keep our skin sort of looking really energized and lovely. What are the other ingredients that you're interested in that are trending right now that we should all be thinking about for the future?
Yeah, so in terms of in terms of pigmentation?
I think in sort of skin health in general,
health,
how to keep the skin glowing, how to keep it sort of looking at its absolute best. Is there anything that we should really be sort of focusing on in terms of the things to get into our skincare regimes now?
Yeah. So, I mean, I'm a big fan of peptides, and I think that sort of peptides are the future.
I keep hearing peptides, but I don't feel like they're a new thing necessarily, but they've sort of been repackaged and made sexy again.
Yeah, no, completely. So peptides are short sequences of amino acids, and they are precursors to proteins, but they also they are messengers to cells, and they can serve a particular function. So you have different peptides for different functions. So there are peptides which can stimulate collagen production. There are peptides which can boost the skin barrier. But what's interesting is that there's now there's a new movement to modulate and to design peptides to have neuromuscular function. So that's peptides that can mimic the effects of Botox.
Botox.
And
amazing.
There's one peptide which is called argireline, or hexapeptide, which has been designed to work in much the same way as Botox, but it's less potent, of course. But it essentially will reduce the flow of calcium, which is required to stimulate muscle contraction. And so what they found when they did a study using this particular 10% solution of this particular peptide was that after 30 days of use, there was a 30% reduction in wrinkle intensity, so around the eyes. So it's essentially Botox in a bottle.
I was going to ask you, do you use it topically? Like, would you just apply it on the areas that you were concerned about lines forming, or would you use it all over the face? Because we also know that, and maybe Yusra, this is something that you do, tiny little microdoses of Botox all over the face, mixed in with the solution, maybe an aqua gold needling device, can also have amazing results on sort of skin oiliness and sebum production and sort of that general tightening of everything, can't it?
I mean, I think the thing about this product is that it's orders of magnitude less potent than Botox. Yeah. And you can use it in that way, although the magnitude of the benefit will be less. But certainly for the wrinkles and the smoothing out fine lines, it has been shown to be quite effective. And it's an alternative because not everyone wants injectable treatment. So it's good that sort of we can create treatments which are more inclusive.
Yeah, absolutely.
Bring more people into the fold.
Give people options.
Exactly.
And talking about injectables, and I don't yet think there's a topical solution or alternative to this, but tell us about polynucleotides, because they are huge in the UK, and I don't know if it's the same in the Middle East yet, but they are absolutely flying, and I think they get the most phenomenal results. But I know you're doing a lot of work with them, aren't you?
Yeah, so polynucleotides are probably my most popular treatment at the moment, and just the demand for them has been going up and up, and I'm sure Yusra has seen the same. And I think Yusra touched on what they are, but polynucleotides are essentially they're derived from salmon or trout DNA, so fish DNA. And what they do is that when you inject polynucleotides into the skin, they harness the machinery of your skin to produce all the components that your skin needs. So they engage with the fibroblasts, which you can think of as the factories of the skin. So they produce all of the collagen, the elastin, the glycosaminoglycans, which are the things that give your skin structure, that give it sort of the bounce, that give it the firmness. And with the polynucleotides, there's very little downtime, and I've seen such great results in terms of the rejuvenation of the under eye and sort of the skin around the eye.
That area is so difficult to treat as well, and particularly with dermal filler, you know, it can attract a lot of water, can't it, because of the HA content. I mean, I know that it will still attract a little water using a polynucleotide, but I had it under my eyes, and I thought I'd never seen anything like it. It was like a filter on my eyes, like the Paris filter, just straight across.
I mean, the effects of the polynucleotides are great because, I mean, they don't last. I mean, the polynucleotides themselves are degraded, but even when they're degraded, the subunits that they're degraded to, they have antioxidant activity, which means that they're going to help protect your skin in another way against sort of the harsh antioxidants, the harsh free radicals generated by UV exposure, generated by pollution. And you're right, they also do draw in moisture, so they have a hydrating effect. And they're just one of these treatments that have so many benefits beyond just the you know, the immediate results.
Yeah, exactly, and I think that's sort of what we're moving towards a little bit more, as well as the sort of long-term gains of a lot of these treatments, not just the fast fix. Final question before we move on to Mona, Derrick. What are the things that you're finding really exciting, excuse me, in regenerative medicine? Because I think we've sort of spoken about a lot of the things that we can do for the body, and obviously there's things like the cryo and the infrared saunas and the amazing things we're going to go on to talk to Mona about. But when it comes to the skin, what is the next sort of frontier of regenerative therapies that we should be keeping an eye on?
So I think a really exciting area is exosomes at the moment. So exosomes can be thought of as couriers, so a bit like an Uber, which is created by a cell.
An Uber in the cells, I love it.
And it conveys information, and that information is in the form of proteins, lipids, mRNA, DNA, and that information is transmitted to other tissues and other cells. And depending on the cell of origin, the information differs. So it can be, if it's from a stem cell, then it's more sort of regenerative, repair information. And what's interesting is that we know that the information or the potency of the information will change depending on the age of the cell. So if you're taking the exosomes from, you know, fetal umbilical cord.
Oh my God, that's just going to be like off the scale,
exactly,
like skin improvement.
Yeah, exactly. So that's really where we're going at, and the whole move towards regenerative medicine is the focus is on sort of helping your skin and helping your cells to produce the things that it needs and to reverse some of the inflammation and you know, some of the things which are going on intrinsically, which result in aging and result in a reduction in cellular efficiency. So, and exosomes, I think, will be at, you know, the cutting edge and really going to be the thing to watch out for. And what I find is exciting is that sort of beyond aesthetics and aesthetic medicine is that exosomes are being investigated for treating cardiovascular disease. So there have been some interesting studies looking at how exosomes can be used to reduce development of atherosclerotic plaques, which are the things that lead to heart attacks.
Oh my goodness, wow.
They've been investigated for treating Alzheimer's disease. And also they've been used as delivery to treat cancer as well. So it's just
these are going to become so pivotal sort of in the way that we live our everyday lives. And I love it actually, because I feel like so much of what aesthetics is doing right now is coming from the world of rehabilitation. And it feels like it's sort of that two-way conversation right now, which makes me feel like we're in the right space. You know, aesthetics, wellness all together, it's exactly where it's happening. Thank you so much, Derrick. That was really, really insightful and fascinating and all of the above. So thank you for being with us. Our final speaker, the amazing woman who we wouldn't be here without, Mona Mirza. Mona has already introduced herself, of course, but my personal connection to Mona is that I met her a little under a year ago. She came over to London, and I was really blown away by all of the amazing regenerative therapies that she seemed to be doing in and amongst running probably one of Dubai's most premier aesthetic clinics. And it's really inspiring to see, I think, somebody who's really challenging what wellness can look like today and really forcing us to question what we perceive as wellness and the things that we ought to be doing. So Mona, maybe you can start by telling us what happens when a patient comes into Biolite for the first time and they don't feel like themselves and they feel sluggish and they're drained and they get the angles and they need to sort of recognize themselves again. What are your first steps? Because there's a lot going on under one roof here.
Absolutely. So thank you very much. First of all, I'd like to say thank you to both my colleagues over here who've actually set the ground for me because this is exactly what we're doing. We're really taking a very much a holistic approach. So we've got a fantastic program which we call the 360 approach, which is basically when a patient does come in, they are able to see our clinicians. So from an aesthetic clinician to our functional medicine clinician. So it's very much tied in together. So we're looking at the inside story, like Yusra very clearly said. What we're really looking at is, you know, the inflammatory markers. It all starts from inflammation. Whether it's your gut, your hormones, your lifestyle, you know. So we're starting with that story, be it even psychological. So whenever somebody is coming in, we assess them right across the board, and then we put an entire plan together and take them through that journey.
I found that fascinating because I came into Biolite actually for the first time only a couple of days ago to see and physically be in this space, and you showed me all of the amazing tests and all the diagnostics that you run. I suspect before a needle even gets anywhere near somebody's face, or before they get to climb onto a treatment table and get hooked up to an IV and do all the brilliant things you do. And I suppose that for you is important. Why? Because you have to have the sort of picture of the patient's baseline health to know what to do with them?
Absolutely. I mean, everything is very evidence-based, and that's because our clients want evidence. They're asking for you know, real-time results. And so when we're working with them, we're not just doing a treatment just to make them look good. And like, you know, Yusra very detailedly explained, patients are looking for a lot more answers. So when we've got the biomarkers and the blood tests and the stool test and the saliva test, along with what we have a fantastic test called the skin DNA test, it gives you something like 18 biomarkers about your skin and how it potentially is going to age. And then that gives us a great guideline as to where we're going to be you know, progressing with the patient as far as patient, you know, treatment guidelines, as well as the holistic approach of biohacking therapies and supplementation.
I think that's fantastic. I mean, having that blueprint, you know, it almost seems silly to think that we'd even do a treatment without understanding what the patient's blueprint would be. And I think it's so important because so much of what we talk about in wellness, you know, there's always a new trend, there's always a new fad. I think it's very easy for us to jump on the bandwagon and go, everyone's taking NAD supplements, I'm going to go and take them. Everyone's taking this new skincare thing, I'm going to do it. And actually, how much more intelligent to actually figure out what your body really needs before trying all of these amazing therapies.
Yes, exactly. And I think, you know, once you have a fantastic detailed report and the doctor's been through it, it's such an eye-opener. It's such an eye-opener because it opens up gateways to so many other underlying health issues that you may not have been aware of.
Agreed.
You know, so many times we pick up on thyroid issues once we've just sent someone for pigmentation through, you know, our functional medicine doctor, and then, you know, we're treating their thyroid. So while we have actually looked at, you know, marrying aesthetics with functional medicine and integrative medicine, it actually helps with longevity. And we're looking at literally treating people at a cellular level, at the root of the problem. Hence why we've got all these fantastic biohacking therapies to assist people with longevity, and not just about, you know, looking good, but literally feeling good and expanding on their health span.
And I think functional medicine is so pivotal right now as well, because it almost gives the patient that degree of control back as well, rather than saying, you know, we're going to put you on medication, we're going to put you on drugs, we're going to manage it this way. I think as soon as you incorporate those regenerative therapies, those lifestyle hacks, it makes the patient feel much more empowered that they have a hand in what their future looks like, and they can go on that journey with you a little more. Tell us a little bit about the more sort of high-tech energy-based devices that you've got in clinic, because I know that you do everything under the sun when it comes to aesthetics, but we're also seeing when it comes to restoring energy a real, I suppose, demand for things that energize the face. And I know that you're using Softwave, which is really, really popular, it seems, in this region.
It is, it is. One of the reasons why I love Softwave, though I tried it myself a couple of years ago and I thought, wow, this completely blew me away. But what made complete sense to me was the fact that it's absolutely perfect for this region. You've got sunshine, you've got you know, all sorts of external factors that, you know, inhibit patients from doing certain treatments such as lasers. With Softwave, first of all, it's an FDA-approved you know, skin tightening device. It has hyper masses of neocollagenesis energy that is being derived into the skin using 7 transducers. Now, the
the great thing about it is it hits you in the mid-dermis, so you're not getting fat atrophy, you're not getting muscle loss.
Which is a concern with a lot of people,
Absolutely.
isn't it? And I know people personally who have said, I've lost fat since actually having high food.
Essentially, that's what's been happening with the older systems.
Yeah.
So with this ultrasound device, we're not getting into that layer of the skin. We're just hitting at the mid-dermis, so you're not getting any fat loss, you're not getting any muscle loss, and you're not getting any nerve damage, which means you're not going to have any asymmetry either. One of the main things I'd say that I've noticed is that it's almost like it's like the gift that keeps giving, because once you've had it, even though it's a treatment that you have once a year, you'll find that it continues to give you results. It doesn't stop at the 3-month mark.
That's amazing.
It continues to give you fantastic results.
And what are the results that your patients are witnessing?
Definitely more contoured jawlines, nasal labial areas lifted, and the main thing is it's one of those treatments that actually targets the necklines. So we're getting fantastic results on the neck and on the submental area, which a lot of doctors really struggle with. I mean, you could use microneedling, and you could put, skin boosters and various other fillers in there. But we love to combine, and we find just on its own, Softwave is targeting the neck like nothing else.
I like that you say also it's the gift that keeps on giving, because I definitely find that from treatments like Softwave, things like the toxin, it has a little bit of a sort of limited shelf life in comparison. Skin boosters the same, but actually it's nice to have that underlying sort of treatment that just carries you through the whole year, just working away quietly in the background.
Absolutely, and I often tell people you can continue doing all your treatments, but you need to put a Softwave in there because it just continues to actually help with the other treatments that you've got going on as well.
Can we touch on sensation? Because I know that with a lot of the traditional ultrasound devices, pain is definitely something that is a barrier for a lot of people when it comes to it. So how does Softwave compare in your eyes?
It's really subjective, because we found some people don't really feel anything, and some people are a bit more sensitive, so they tend to feel it a little bit more. But if I was to compare it again with, let's say, radio frequency microneedling devices or the traditional ultrasound device that you've experienced, and so have I, and where you're left with months of pain in your jaw.
Like you've been run over sometimes by a truck, don't
absolutely.
you? So it really goes into the bones.
It's nothing like that at all. I mean, you do feel a bit of a pinch, and then the moment the treatment stopped, the pain is gone. And so that in itself is such a relief, and you could just look forward to the results.
Yeah, exactly.
I think the other advantage with the ultrasound is that it's colorblind. So literally anyone can do this treatment.
Yeah.
We're also finding that when we're doing it, with people with slightly older skin, and we're combining that with, let's say, Sculptra or polynucleotides, the results are absolutely mind-blowing.
I was going to ask you what it sort of went nicely in combination with as well.
Fantastic results.
All of these.
Yes, it's really wonderful. And it doesn't have to be an annual treatment. You can, in some cases, do it, in about 6 months' time. Again, you would assess the patient and see if they would need to come back, or they'll come back and say, you know what, I love this. Can I do a little bit more?
Yeah.
Though, to be honest, Softwave says doing that one treatment should last you enough, and the second treatment will just give you a little bit more.
Yeah,
but
it's more like the maintenance almost, isn't it? That first hit. I mean, there are amazing sort of studies to show like the lift in sort of the eyelid almost from doing it around the eyes.
Absolutely.
It's incredible. I need to book in for some, I think. I'm going to put myself up for that raffle.
Yes, it's perfect for the vector lift. You get that lovely lift in the tailbone. But what we're really, really seeing is enormous results on the neck, which, people have really struggled to get results on.
It's such a tricky area, isn't it? And it sounds like you've obviously got sort of a lot going on in the sort of regenerative space as well, but I'd love to know what you find personally as a woman, as the person running this amazing clinic. You travel a lot, you have a family. Like, what are the things that you rely upon, whether it's physical or whether it's sort of the emotional sort of support? What do you rely on to feel energized yourself?
Honestly, coming to work.
I love that.
It really gets me out of bed. I know it's really, really difficult to quantify why I'm driven this way, but honestly, I love coming to work.
I'm not surprised. Look at all these devices you have here.
Yes, I have a fantastic team. I think, Yusra, you probably know, we're sort of cut of the same cloth. But no, I've got an incredible team. I do a lot of ozone therapy. The 10 pass ozone is my go-to. Helps me with my sleep, helps me with, my energy levels.
The ozone is amazing. I tried that for the first time in Dubai a couple of days ago. And in fact, you were explaining to me, it almost like cleans out and supercharges the blood, doesn't it?
Absolutely. I highly recommend it to everyone. And I think it's so important that that element of looking at the inside through biohacking therapies, such as ozone therapy. We also have a detox chamber, so we do far infrared saunas, and occasionally I like to do that to just, help me sleep a bit better.
Do you know what I loved about your infrared sauna is that you have the LED mask and you have everything that happens at the same, like the oxygen dome.
Yes.
And I think also for people probably living and working in a place like Dubai, they need maximum efficiency from their treatments as well. You can't lie there for 20 minutes having nothing else done. It's like, do your LED, do your oxygen at the same time, be firing on all cylinders when you come to leave.
Well, we do a lot of mixed treatments, even when somebody is having a treatment or a facial where, we've got them hooked up to a laser IV or IV infusion. We're always, and everyone is running. They want to do as much as possible within an hour.
Agreed.
So, somebody under EMLA for, let's say, 45 minutes, getting ready for, let's say, a Softwave treatment. We're already doing things for them and preparing them.
And we can go and have a look maybe after the talk and sort of explore all these amazing rooms. There's that sleep pod, which looks incredible with all the sort of, what does the sleep pod do exactly? So I was just going to talk about the twinkly lights, but there's much more than that.
Yeah, it's the Rolls Royce room. It's binaural acoustic therapy. So we are using binaural frequencies to actually create neural pathways that will help bring down your heightened frequencies so that you can sleep better. It helps with anxiety. It helps with someone who's lacking focus. We could do exactly the opposite and heighten your frequency so you get hyper focused.
Amazing.
So it depends on what we're looking to treat.
So you can really control someone's energy through doing all of that.
Yes, absolutely. And the whole idea is that, the approach is to start from the mind all the way down to the inside and, focusing on the inflammation, focusing on energy, focusing on the whole mind, body and aesthetic side of things.
Yeah, you're doing a beautiful job. Final question for you, Mona. What are the things that you're most interested in introducing to the space in the future? Because it feels like you have everything under one roof and that it's all very evidence-based and cutting edge already. Is there anything else out there?
So the next thing that we're very close to introducing is stem cell therapy.
Amazing.
And we're very, very excited. There's a lot of interest in stem cells.
Yeah. What would you be using it for specifically? How would patients then sort of benefit from it?
So you can have it simply as an IV infusion. So it starts working at organ regeneration as well. But we're also going to be focusing largely on the skin and hair loss. And that's really what people are really looking to do now and see how that's going to help them. So that's very exciting. And the stem cells, again, a lot of people ask, well, where will they be derived from? Well, you can actually have donor stem cells, though we would prefer that the stem cells are either from your own fat cells or from someone from your own family, such as your fatten up your kid, so you get at least a few mLs of fat cells from them.
Not hard. Have some ice cream with that. But actually, it goes back to what Derrick was saying. Unless your body naturally has the resources which you want to be using because they are energized and efficient and they're going to get amazing results, there's almost no point. You do need to get the resources from maybe children.
Yes, absolutely.
Gosh, what a funny concept. Yeah, exactly. Make more. I'll be looking at my son when I get home. Go, no, I can do that with you. Back into my face. That's really, really interesting, and I can't wait for our trip back here next to see what you're doing with the stem cells.
I look forward to having you back again.
Oh, thank you. We'll be very, very soon, I'm sure. Thank you, Mona. Really, really interesting. That's brought us to the end of our sort of panel discussion anyway, and I just have to say I found it so fascinating, and I hope you agree to listen to all of our speakers. When we think about how to go firing on all cylinders, and it feels like there are so many different ways to do it. And I think in a place like Dubai, it evidently feels really important. It's not just a nice to have. It would be nice to feel energized. It really does in this region feel like a necessity. There is a lot going on. There is a lot bombarding you. There are a lot of things pulling you in different directions. But I think all of you alluded to the fact that actually this isn't just a quick fix. This stuff really is about sort of setting ourselves in the best possible state for the long term. It's about managing our immune systems, our hormonal health, our mental health, our emotional well-being. These are the therapies that are really going to keep us intact and whole and future-proof us so that we can feel really resilient, which I think is super important nowadays.
I was going to say, traditional medicine has helped us to live longer, but not necessarily enhanced our health span. So our lifespan has been improved, but not our health span. And the idea is if we're going to live longer, let's live a healthy, happy life.
Yeah, exactly.
And I think another thing is with these kind of things, I often hear patients thinking it's a lot of woo-woo, but we wouldn't be standing here talking about these if we didn't believe in the scientific evidence of Softwave, of Emerald Laser, for example.
Your so many years of training and sort of medical schools and various things that you've done, you know, you want to stand behind devices and, you know, modalities that you truly believe in, that have the papers to prove it. And I think all of you really stand up to that, which is why you're such a superstar panel to have here, because I trust implicitly what these people say. We've got some time for some audience questions. If you do need to scoot, we have goodie bags for everyone. Please don't forget to pick them up. They have amazing things inside them. You'll be very unhappy if you get home and realise you've left it behind. And there's also the Softwave raffle, so please do make sure you do that. But were there any questions, first and foremost? This is where I look around the room. I'm like, who's going to be the first person to put up their hand? Oh, question here.
So you guys are talking about regenerative medicine. I'm curious what your favorite skin boosters might be.
Depends on what I'm trying to achieve. If the patient has poor texture or they have acne scarring, for example, I see lots of patients with acne scarring. The only skin booster that is licensed for improvement of acne scarring is Restylane Skin Boosters Vital. I think if you're using the wrong skin booster, you're not going to be happy with the results. So it's very important to first ascertain what it is you want to achieve, what it is that's bothering you, and then pick the right product to solve that problem. If it's pigmentation, there's a product called Belotero Revive. I don't know if you have it here. You do, yeah? Belotero is a product from Mirza, and it's the only skin booster that has hyaluronic acid and glycerol as a combination, and it's the only one that's licensed for treatment of hyperpigmentation. So I use this as a...
It's nice for redness as well, isn't it?
It's amazing for redness.
I had it a little bit across here. It's beautiful.
And I actually use it off license as well for the periorbital area, for patients from Asian, Arab backgrounds who have a lot of pigment in their skin, particularly around the eye area. It's fantastic for that.
I have a question regarding stem cells. So the fat does it need to match a certain, does it need to match my body type or blood type, or can it be donated from?
Yeah. So you can actually even have donor stem cells. So it can be absolutely anyone.
So I can grab anyone from here.
Who has the best skin in here?
You can pick your...
Yeah, exactly. Go for her.
Does it make a difference if the younger the better? Or?
Yes, definitely.
Yeah.
Definitely.
And umbilical cord.
Yes, of course. If you've got access to that, then yes. Like the laboratories over here that we deal with have that. So the choice is yours. You've got, a donor stem cells, umbilical cord stem cells, or your own fat cells. The key is to really keep in mind that right now, the way I see it is if you keep it in the same gene pool, it's probably the safest, because there is research to say that it can effectively, change your DNA. Yeah.
And I think when these therapies are so new as well, you always want to take the route of safety. The most cautious and safety, don't you?
Were there any more questions? Sadie first.
So I don't offer this treatment, but I want to know about it. Because my knowledge is limited, but with PRP, given that we've got all these stem cells and polynucleotides and all these magical advances coming out, is it becoming less relevant? Are we directing our patients away from it? And how does that stand in our industry now?
Do you both do PRP? Yeah.
I do.
You don't do it?
So I think with all things, there are positives and then there are limitations. I still offer PRP, but this question that this gentleman had was actually really relevant, because not all people's PRP is going to be the same. So if you haven't slept well, if you're a smoker, if you're drinking, if you're dehydrated, your PRP isn't going to be as good as Mona's PRP, who's doing ozone therapy and looking after herself. So it comes down to what I'm trying to treat and the patient's pre-existing health. If their health is not really good and they are a smoker and they're not, that they're maybe living a suboptimal lifestyle, then I'm going to go for polynucleotides, because that is a consistent product in every single vial, whereas their PRP might not be the same or might not be optimized. And I often do combinations. So for hair loss, I do polynucleotides because you can do polynucleotides for hair loss as well. And my protocol is 3 sessions of polynucleotides, 3 weeks apart, and then I do 6 sessions of PRP. So combination treatments are always going to yield the best results. Polynucleotides can take us so far by stimulation of fibroblasts or hair cells, and then PRP has, or PRF, has a level of stem cells within it and growth factors that will help to take you that much further. So combination treatments, I think it still has a place in our industry.
I was writing a feature recently on biostimulators, and I spoke to one doctor, one surgeon, who said PRP is like the original biostimulator, and it's been used for decades, hasn't it? And it's so interesting that your point about, you know, we just need to use the resources that have the most efficacy, because obviously I think it was used for a long time, and then people probably started to realise, actually, there are better sources we can find. Derrick, did you want to say something?
Yeah, I think also what's important with PRP is that we're getting a better understanding of what it is in PRP that's causing the effects that we observe. So, I mean, there have been studies that show that even if you take out the platelets, that you're still having those effects. So what is it? And a lot of people are drilling down that it could be, in addition to the growth factors, are actually exosomes.
Yeah. I've even heard of people injecting it into the bone now, almost to sort of stimulate the osteoblasts and produce. But I mean, that's going to be the whole next frontier. I think as soon as we're regenerating the bone, I know we're starting to do it a bit with polynucleotides. They do say it stimulates osteoblasts, but I think, you know, when we can rebuild our faces, that's going to be game changing.
I've done a whole podcast on polynucleotides.
Amazing.
And polynucleotides actually have been around for 75 years. People think it's a new thing in the industry. It's actually been around for a really long time.
Wow.
But it was traditionally used in wound care, patients who had burns, to help with regeneration. And then slowly but surely it moved into the aesthetic industry. Similar with PRP. PRP has been used in joint health for a really long time. Even exosome therapy has been used for a long time. Back in the day, they used to also use leeches. Remember that? They used to use leeches for health. Now that's going back into aesthetics.
Really?
It's being used for complication management for vascular occlusions. So people are having these leeches hanging off their noses, don't we? Sounds wild and wonderful, but honestly, you know, again, even like light therapy, like Emerald Laser. When I first heard about Emerald Laser, I remember thinking it was woo-woo. Vanessa had to really come and show me all the clinical papers. And then when you think about it, if you think about it from, again, the scientific background, the evidence, we as human beings are actually made to absorb light. So even if your eyes were closed, and your skin can absorb photons of energy. And the easiest examples of this is when you're sleeping, and it's dark, and then the sunlight comes through in your window. Your eyes are still closed, but your body starts to absorb light, and that sets off a hormonal cascade. You start to get the release of a hormone called cortisol, which wakes you up and energizes you and gets you moving. And then when the light is gone, you start to get a suppression of cortisol and upregulation of a hormone called melatonin, which helps you to sleep better. And often, because people here are hiding away from the sun and people in the UK are running trying to find the sun because we have none, our circadian rhythms are out of whack. But again, so it comes down to when I was trying to understand, although it's not a light laser, it's not light, it is a true laser. Our bodies are designed, it's grand design, our body is designed to react to energy. Hence, even when we're talking about sunlight, the skin cells react to sunlight by producing more melanin. And I always tell my patients wear SPF come day, every single day, whether it is sunny, whether it is raining, whether it is snowing, except in the first 45 minutes after sunrise, because in the first 45 minutes after sunrise, there's very little UV. There's a lot of infrared, which actually has anti-inflammatory properties in the skin and helps to upregulate your skin's own natural sun protection. The functional doctors are nodding. So, yeah, our bodies are phenomenal.
And that's when you get the vitamin D as well.
That's when you get the vitamin D.
Yeah, very important. Yeah. Are you going to introduce leeches soon? I'm fascinated by this. Probably. Who's going to be the first to do that?
Yeah, but there is so much information out there, and it can be really overwhelming.
Well, your podcast is a really good place to start, actually. I was very fortunate to be a guest on that a number of months ago. So, that's a good one worth checking out. Were there any other questions? We wrap up. I'm sure the speakers will be here for a little while longer. So if you do have anything you'd like to ask them one-to-one, I'm sure they'll be very happy to take that. But all that's left for me to say is an amazing thank you to our beauty triangle. All such authorities and experts. I'm sure you've learnt just as much from them as I have. And also thank you to all of you for being here with us. It's been such an amazing experience, such a great way to kickstart the Beauty Triangle's Dubai debut. We couldn't have asked for a better audience. So thank you for being here. Thank you for the questions, for engaging with it, and hope to see more of you.
Thank you so much. Thank you.
And thank you to Mona for hosting us.
argument, to be honest.
Oh my goodness. I couldn't. I didn't put my card in though. Shall I? No, I'm joking. I'm the last person.
No, it's fine.
No, but
Honestly, it's fine.
you said you wanted
Don't embarrass us. Naomi O'Connor.
Ooh.
Oh, she's going to be very excited for that. Oh, thank you guys. That was so amazing.